Broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone, and welcome to our webinar. We are hosting our webinar on behalf of the Orthotic Group. My name is Tina Karam. I'm the marketing coordinator for the Orthotic Group and a couple of the other brands under the OHI umbrella. I do see some regular webinar attendees online, so thank you to our practitioners that have been dedicated and always coming online with us and learning. We appreciate your loyalty, and welcome to our new practitioners online as well. Appreciate you spending the hour with us to learn, and we hope that this encourages you. Attending this webinar encourages you to join us for future educational programs. So we do have practitioners from different parts of the world. I just want to mention we have customers joining us from Canada, the US, Australia, and Europe. So depending on where you are, welcome in the morning, might be the afternoon, or even the late evening, like here. We're from Markham, Ontario, so it's about 7:30 here. But yeah, so thank you so much again. This is our last webinar for 2019. A very exciting and interesting topic to end the year, and a super dynamic speaker to end the year off. It has been quite the year. We were happy to bring back a good full packed schedule for you with lots of different topics, variety of topics and content to learn from. So we hope that you join us in the new year. And I'll talk a little bit more about the schedule at the end of the webinar. So again, my name is Tina Karam, and you'll be getting some emails from me afterwards. I'm sure you've received some correspondence throughout the year about marketing and different programs that we have. So feel free to reach out to me anytime through email or phone. Happy to help you. So before we get started on the presentation, just to mention, this is a webinar, just so everyone knows we're at the right place. Orthotic therapy for a variety of different sports. That's what we're going to be talking about tonight. It'll run for about 45 minutes, and then we usually have some time at the end for questions. But before we get to the presentation, I just want to go through the GoToWebinar screen. So everyone should see on towards the right-hand side a control panel. This is where you'll have the opportunity to communicate with us. Right now, everyone is automatically on mute, and that's just so that we can control any background noise, and so there's no noise during the presentation. But if you do have a question, you do have the opportunity to ask. There's a chat box at the very bottom. You just need to click on the arrow and a box will pop up. You can chat through that. I find the best way to communicate is the question box. So you just click on the arrow, a box will pop up, and you can type in your question there. Either way is fine, but we tend to see the questions a little bit more clear. And there also is an option you'll see to raise your hand. That just notifies us that you have a comment or a question. You can do that as well. If you are having any troubles with your audio, sometimes that may happen. It could be the Wi-Fi connection. I know I've had that happen where it's my voice has gone in and out, and there's been some interruption, and that's just where I am. So I've moved my computer, and sometimes that works depending on where you are. But if you find that the audio is completely off, then you can use your phone as the speaker. You just need to click on where it says audio, and there's options. You can use your computer, which most of you are probably doing, or you can click on phone, and that will give you a phone number with a code. Once you dial in, it'll ask for a code. You type that in, and you'll be able to use your phone as the audio. So you'll be able to hear us through your phone, and hopefully your computer's working. You'll be able to follow along on the slides as well. So hopefully everybody can hear me. If you're having trouble, please raise your hand, send in a question, and we'll be happy to help. About questions, what we like to do usually, because we have limited time, is we'd like to gather all the questions during the presentation and answer them at the end. We find that is a little bit more helpful. You can jot all your information, all the thoughts that you have into your question box, and then we'll be addressing them at the end. And so if we can't get it into your questions during the webinar, then you can certainly reply back to me, and I will pass on the messages to Dr. Lustig. He also will provide you with his direct email and phone number as well. You can actually directly ask him questions instead of going through me and waiting a little bit to get to him. So those are some options if we can get to your questions this evening. So without further delay, I'd like to give you a quick introduction to our presenter. Again, his name is Dr. Alan Lustig. If you've been to some of our live seminars, you've met Dr. Lustig. He's been presenting for the Orthotic Group for well over 25 years. So he definitely knows this stuff, and I've had the honor of working with him for 9 of those years, so it's been great. If you haven't attended one of our live seminars in Ontario, please come. They're very informative, a packed day of great information, and we feed you there too, which is great. So, and also too, we're trying to bring our live webinars to different parts of North America, and we also try to bring them also to Europe and to Australia when we can. So not limited to Ontario. In the new year, we'll have a new schedule, and hopefully we can bring our seminars elsewhere. So Dr. Lustig is a podiatrist. He's Chief Medical Director of the Orthotic Group as well as Langer Biomechanics. He co-founded the Orthotic Group in 1986 and graduated from the New York College of Podiatric Medicine. And he's been practicing in one of the busiest clinics in Canada for over 40 years. And he treats abnormal gait conditions with foot orthotics, and he also dispenses AFOs. So for over 30 years, he's lectured in over 50 cities across North America on biomechanics and foot orthotic therapy. So I think I've spoken enough, and we have a lot of content to cover. So I'm going to pass on the floor to Dr. Lustig. Enjoy the webinar, everyone.
Okay, thank you, Tina. Welcome, everybody. One of my favorite areas of orthotic therapy to talk about is sports medicine. Today's program tonight, we're going to talk about, first of all, the different biomechanical properties of the different common sports that you'll see in the office. We're going to talk about the custom foot orthotic solutions for specific sports, all the most common sports. And we're going to try to take a systematic approach on how to design the correct sport orthotic designs for each different type of sport that you see, selecting the correct materials for sport orthotic designs, and we'll discuss on just what each material does, different cushioning materials, different materials that are better for preventing blisters, and they take a twist more easily than pour on. We'll talk about that. We're going to pick the best sports shoe. Sports shoes are very important, especially when most of the sport patients that I see are related to running, and we'll talk about all the best shoes available for running, walking, and then we're going to sort of match the correct orthotic design for each of the different types of sports footwear, which is very important. The type of footwear you're wearing has a great effect on the type of orthotic you're going to get for the sport you're in. I began practice a long time ago in 1974. In 1974, I became a podiatrist, and really my practice was mostly seeing senior citizens. At that time, a podiatrist, probably my average patient was 61 years old. I enjoyed what I was doing. I never really saw sports coming until 1977. What happened was the running boom started. And for me specifically, here in practicing in Toronto, Langer Laboratories took out a full-page ad in Runner's World magazine to show the public what a sports orthotic looked like. And basically the ad said, if you're running and having problems, foot problems, knee problems, maybe hip problems, you should see your podiatrist to have a biomechanical examination to see just how your running mechanics are and your running style is. And that ad changed my life. in a couple of years, my average age patient was 31 years old. I've always been sort of an athlete. In university, I played college basketball. I went from treating senior citizens to being somebody who was really active in treating athletes, team athletes. I really was happy, but it's just amazing what happened. Once the running boom started, and so many people were wearing terrible shoes because there were no great running shoes, that many patients uh, needed orthotic therapy more than today even. And today, a lot of the great shoes help to solve problems by themselves. Back then, very few running shoes helped improve running biomechanics. When we're treating athletes, obviously each sport is different, and we've got to look at the different aspects of each sport. One thing we will have to look at when we see a person who's participating in sports is the type of surface they're playing on, and the specific sport is really going to be running straight ahead, or if you're doing a court sport, you're running side to side. So every sport has different sort of motions involved. Shoe designs for different sports are very important because anytime you're getting into orthotic therapy, the shoe part of the therapy is very important. Size of athletes, obviously, uh, most podiatrists will see, and most foot practitioners will see people in the general community, but then there's high school athletes, college athletes, and professional athletes. So the bigger the athletes, the more complicated uh, treatment gets. And many different sports, there are different positions, literally, where if I'm seeing baseball players, a catcher is not getting the same orthotics that a pitcher may get. So there's a lot to consider. Obviously, whether you're playing outside or inside is very significant. Turf shoes are very different than the shoes we use on artificial surfaces. And most of the time, turf shoes, because of their spike patterns, create a problem. And they're sort of working against orthotic therapy because most of the time, when you've got different spike patterns on especially the heels of shoes, which may be placed too narrow, it really is hurting the control you're going to get from an orthotic when someone is running. So the type of the spike on shoes is very significant. When we're looking at sports shoe designs, we're looking at a baseball shoe here. Um, this baseball shoe is actually good because, as you can see, the heel spikes are very close to the back of, I'm just trying to get my pointer going here, okay, are very close to the outside edge at the heel area. Okay, they're not placed inside. Okay, very significant. These are metal spikes, and when you're looking at different spikes, we'll go into it. There are some longer spikes, shorter spikes, very nubby spikes. They all change how orthotics are going to affect how somebody is playing their sport. Obviously, straight or curved last shoes will make a difference. Most of the shoes today are more straight and always are going to give better support than a curved last shoe. A good idea if you're ordering orthotics to go into sports shoes is what I do is I usually take a Xerox copy, a photocopy of the insoles of the shoes and send it along with my neutral position molds so that the lab can see exactly the shape of the shoe, the width of the shoe, whether it's a curved or straight last shoe. It's easier to design the shape of the shell to fit and sit better inside the shoe itself. We'll talk about baseball first. Baseball is a good sport when you're treating athletes. The shoe is good, it's a roomy shoe, and that's a very positive thing. It's not extremely deep like a running shoe, but it's usually pretty wide so it accepts a full size sport orthotic, a sport flex from TOG. Okay, a wider, roomier shoe is a big plus in fitting an orthotic in properly. When I'm prescribing orthotics for baseball players, I try to use the GPS, the grind post into shell direction on the making of the orthotic. Just GPS means that the rear foot post is as thin as possible under the center of the heel, so it lifts the foot out of the shoe as little as possible. And this is a good idea in whatever orthotic therapy you're doing. If you're making orthotics for a shoe and are not sure how deep the shoe is, putting on the order GPIS tells the lab that you want the thickness of the orthotic, okay, right under the center of the heel. You want it to be as thin as possible, and the post is actually attached after some of the shell, the middle underneath the heel, is ground away, so that you're getting the minimal heel lift. Most baseball players are playing on grass, no matter what level they're in. Fewer and fewer stadiums now have artificial turf, so a real grass shoe is going to have metal spikes. And what you're looking for, if somebody's coming in and they're showing you their shoes, is to make sure those spikes are to the outside edges of the heels. More important at the heel than the ball of the foot. GPS, as I mentioned, okay, full length, a thin full length orthotic. You don't want to make it too thick. As we go through this presentation, I'll say over and over again, athletes, especially serious real athletes, don't want a big, thick orthotic in their shoes that takes up a lot of room and lifts them out of the shoes. The more athletes, the more serious athletes you take care of, you'll see they're looking for a thinner orthotic if possible. Very often, the success of treatment means a thinner orthotic, a compromise, rather than something too thick that is not going to be comfortable and won't fit in the shoe easily. Especially if you get to the point where you're seeing college or major league baseball players or any professional sports guys. They want the thinnest orthotic they possibly can wear that's going to do the trick. Okay. For my typical baseball player, our Targ Sportflex, full length with an ETC top cover, a 2 or 3 millimeter shell, depending on how big the baseball player is, and sometimes some of these baseball players are quite large and need a 3 millimeter shell. 2 millimeters is usually good for players up to about 160 pounds. Above that, I'll go to a 3 millimeter shell to give the proper support to the orthotic. GPIS, again, I mentioned that a lot. You don't want a baseball player coming out of the shoe. Basketball is an interesting sport because not only are people running around, but they're jumping, and they're jumping all the time. And there are big guys who are jumping. And I think in no other sport do I see more problems with injuries almost related to crush. Okay, the tarsal bones, heel bones, subtalar joint. These big guys who are jumping high distances. It's amazing how high up they get, and they're coming down. And no shoes. If you're 270 pounds and 6'10", and you're jumping 4 or 5 feet in the air and coming down, no shoe has enough cushioning and stability to prevent all possible injuries. A lot of big basketball guys develop some really bad sports injuries that need some serious surgery. Probably the toughest athlete to treat is a high school, university, or professional basketball player because of the jumping and the running and the different feet that they seem to have. The real big guys in a lot of the population are black athletes, are guys with very flat feet that aren't very pronated. This is very unusual. It's important to examine basketball players' feet very carefully and to understand what's going on with the biomechanics of their feet before you're ordering orthotics, because unlike any other sport, I would say I probably order 5 different degrees of rigidity for basketball players. The really big guys with very flat feet that aren't pronated flat feet, that are just very flat and almost in a neutral position, they really need some soft orthotics. They can't tolerate high arched 2 or 3 millimeter plastic designs. Um, Probably the sports medicine aspect of basketball needs a lecture all by itself. Okay, they're the hardest athlete to treat because besides the running, in all different directions, there's the jumping. So it's a very interesting foot to look at. Um, Interestingly, um, the orthotic on the left is size 11. The orthotic on the right is size 22. One of the NBA players I see from the Raptors, 7'5" guy, and I've seen a lot of big feet over the years, a lot of 17s and 18s. I've never seen a 22 before, so took some pictures. I saved his mold. This is one big boy. Not only is he 7'5", he's about 350 pounds. So it was quite an event to make him a good, sturdy orthotic that will last. I originally saw him because his um, his manager brought him in to see me, and they had orthotics made from someone who, because of his size, I think felt they would make him grandma style orthotics, which wore out in exactly 1 week. Just because guys are big and gigantic and jump doesn't mean they need a mush orthotic that's very, very soft and obviously can wear out and be destroyed very quickly. As you can see, the average university player is about a size 15. The average high school player is about a size 13 and a half. These are all big feet. I see a number of the Raptors. The Toronto Raptors, the average team size is 16 and a half. That's a pretty big foot in itself. Size 22 is just amazingly gigantic, and I enjoy showing patients this basketball player is my patient. I can't mention his name, but his molds. Shaquille O'Neal, who you know probably, is a very famous basketball player. He's a size 22. He's a big, big guy if you ever see him on TV. No matter how big the other guys are around him, he's always the biggest. He wears a size 22 shoe. I first saw the size of his feet when I was in New York City at the NBA store, and there's sort of a bobblehead of Shaquille, a 7'2" bobblehead, and you just stand next to him and you can see the size of the feet. Quite amazing. Different types of orthotics I mentioned. If someone is a basketball player, has very flat feet, is not really a pronator, they need a softer orthotic. The average basketball player probably gets a 2 millimeter, so it has a little give with arch fill. GPIS is important. You don't want to lift the heel too much, or you'll have some inversion sprains. Luckily, basketball shoes have plenty of room to them, and basketball shoes matter. These days, there are lots of different styles, lots of fancy colored shoes. Basketball players, just like joggers, need a good, stable shoe. The heel of the shoe should have a good, stable, solid counter to it. I have a list of recommended shoes that I give to basketball players. It's important to get an orthotic, to properly work in a shoe. A soft, mushy shoe is never going to do the job. You need support. You need support. You want to make sure you're doing the proper examination. If a basketball player in stance has valgus heels, you know they've got a compensated forefoot varus. You want to make sure that they're going to get a forefoot post to sulcus. And you're also going to make sure that they have the proper top cover that's going to last. And for basketball and for the roughest athletes, I use what's called Lunisoft. We'll talk about that in a little while. So this is a picture of an elite basketball. The entire bottom is covered with vinyl. It's encapsulated. Most, especially NBA players, will go through a pair of shoes in 1 or 2 or 3 games. So you know your orthotic has to be very, very hardy, that'll be able to last a reasonable amount of time. Best way to do that is to encapsulate it with the top cover being Lunasoft, which is a sort of a single layer shock absorbing material, so the layers won't split from the top. On the bottom, it's fully covered with vinyl. Okay, there's a white vinyl on the right, but most of the vinyl we use is a black bottom cover. Okay, a pour-on mid layer. In other words, underneath the Lunasoft top cover, there's a 3mm mid layer of pour-on from heel to toe. 0-degree rear foot posts. All sports orthotics that have a heel that's cupped, a heel cup, need a rear foot post, and I very rarely tilt rear foot posts these days. Earlier in my career, almost everybody got a 4-degree rear foot varus post. Now, most of the posts I put on are 0 degrees. They give good solid support. They don't cause inversion sprains. They don't get the foot starting to sort of slide laterally off the orthotic. I'm a big believer in 0-degree rear foot posts. The bigger guys over 260, 270, 300, I'll add a arch made out of pour-on if needed. Football. Treating football players, you got to know the shoes they're wearing. Very important. Very important to evaluate the shoe that football players are using. On grass, usually the spikes are quite long and thick plantar spikes. If you're lucky and they're playing on artificial turf, then you'll see some of the examples where there's a ton of spikes under, which really gives you a better heel stability. The more spike contact to the ground, the wider the spikes are, the more support the football player is going to get. Due to size, many of the football players I see are 300 pounds plus. Okay, they're going to tend to get a full arch fill made out of pour-on. And as the picture shows, the single most common injury I see, and probably anyone sees in football, is turf toe. Turf toe is osteoarthritis of the big toe joint. There are many different causes, but once you've seen the patient and you see the enlarged toe joint, and you can see there's very little movement at the first MPJ, you can see all the pain they're having, you know the way to get and control that pain is to stop that joint from bending as much as possible. If a football team really doesn't have a podiatrist involved, most athletic trainers will fit a stiff metal insole from heel to toe inside of their shoe. That just makes the shoe solid. The shoe doesn't break at the ball of the foot. No bend, no pain at the first MPJ. If the team's got a podiatrist, even better. They're going to get a neutral position molded orthotic with a rigid Morton's extension, a rigid plastic Morton's extension. To order what you're seeing here in the lower left-hand corner, I've got, because I don't want the plastic to break, a 3mm shell, a Sport Flex orthotic 0-degree rear foot post, and a rigid Morton's extension. Very effective. Not only do you get some support, not only do you get the arch support you need, you're controlling some of the subtalar joint pronation, but also you're stopping the flexion at the first MPJ. I put Steve McNair's picture in here because 2 weeks before the Super Bowl in 2000, we got a call to make him a new pair of orthotics, and that's the orthotic that we sent down to him. And unfortunately, the team, the Tennessee Titans, lost the Super Bowl. One of their ends was tackled 1 yard from the end zone at the end of the game But Steve McNair rushed for 100 yards, and during the telecast, didn't mention our names at all, but mentioned that he was wearing special shoe inserts that take the strain off of his big toe joints. Quite a long time ago, but I had a big smile on myself watching that game. He ran great. It was really quite amazing. Unfortunately, it's 19 years now, and he's recently passed away, but he was a long-term patient of the lab. Reduce bulk, reduce bulk, reduce bulk. I can't say that enough, especially football players. Big, thick orthotics just don't make it in the sports world. Okay? Big, thick orthotics don't make it in the sports world. Let me just get rid of that. Almost all professional and university athletes want something as thin as possible so they're not stuffed into their shoe, they're not lifted out of their shoe. So many times I see athletes come in with a very thick, soft orthotic. They're getting support really from the mass of the arch of the orthotic, and they're just not comfortable. They're inverting the foot too much. There's too much in the shoe. I can't say it enough that when you're making orthotics for serious athletes especially, the thinner the orthotic, the better. Ice hockey, very unique sporting footwear. Very unique. Because of the shape of the skate, the upper of the skate goes way above the ankle joint, and it has to be cupped around the medial and lateral malleolus. So if you're putting an orthotic that's thick at the heel in an ice skate and raising the foot, the ice skate's just never going to fit properly. Okay? Ice hockey players, especially the real good ones, sometimes don't even wear socks. They've got all kinds of lumps and bumps, pump bumps, lots of problems with their feet. As you can see on the right on the bottom, and this is an orthotic I use in a lot of instances, especially for athletes, not for running shoes, but for athletes that are wearing strange shoes, and we'll go over those different types of shoes. But certainly ice hockey, ice skating shoes, figure skating shoes, and ski boots just don't have enough room. I don't want to raise their heel, so I'm using what we call at the lab Dr. Al's flat heel cup shell. Because the heel cup is flat, it doesn't rock. It's a 2mm shell usually. It's very thin, and it fits great in ice skates or, as I said, ski boots. It's very thin. Most of the practitioners who order this will send us a Xerox copy of the insole from the skate or the ski boot just to see the size. But you're looking at the shell. What I do for these sports is a full-length top cover, a 3mm Lunasoft top. So there's a full-length top cover on it, but that's basically what the shell of the orthotic looks like. Very thin, 2mm for most athletes, and a flat heel cup. It is very successful. It is very thin and easy to wear, and athletes doing ice hockey, ice skating, figure skating, or skiing appreciate how deep they are in the boot. It's a compromise. It's not as good as a heel cupped, rear foot posted running orthotic, but it fits great, and most of my athletes get 2 pair of orthotics, a pair for their running shoes and walking shoes, and then a pair for their literally different sport shoes. So what you're looking at is a flat heel cup orthotic, a full length, a red Lunasoft top cover, and this pair specifically has a vinyl sandwich that's strengthening the top cover where the plastic ends at the ball of the foot, so it doesn't tear. Okay, always good to make a Xerox copy of odd shoes, and odd shoes to me are ski boots and ice skates, and also soccer shoes too. To me, soccer shoes is very odd shaped and odd made sport shoe, and I will always send along a Xerox copy of the insole of ice skates. A lot of people play golf. They walk and walk and walk and have problems, and really need orthotics because of problems with the biomechanics of their gait. But there's also a swing involved. So not only do golf orthotics have to be made to correct gait, but also to take into consideration the very unusual movements of a golf swing. Whenever I'm treating golfers, one thing I always mention to them is that if they're having problems, if they're just starting with new orthotics, or if they're wearing their orthotics for a long time, walking up and down steep slopes should be eliminated. You got to walk. If there's a shortcut from green to the next tee, if you walk straight up a hill, it's not good. As everybody knows, going uphill triples pronation, not good. Walk around. If you're a golfer, don't look for shortcuts up and down hills. It's always a problem. To accommodate the intricacies of a golf swing, if you're making a pair of orthotics for a golfer, a reverse Morton's extension on the right orthotic for a right-handed golfer, okay, allows proper foot plant during the swing. Okay, a reverse Morton's extension. What you're looking at in the additions and modifications area of the order form for a TOG orthotics is the reverse Morton's extension. Okay, here it's checked off on both. This is that shouldn't be that way. A right-handed golfer gets a reverse Morton's extension on the right side, and a left-handed golfer that's swinging the opposite way gets a reverse Morton's extension on the left side. Okay, so there's a buildup placed under metatarsals 2, 3, 4, and 5, letting the first MPJ plantar flex. And right-handed golfers, a right reverse Morton's extension. Left-handed golfers, a left reverse Morton's extension. Mentioned this already. Be careful walking up and down the hills. You got to be careful walking up and down the hills. You're really looking for problems if you take that shortcut and walk straight up a severe incline going uphill to the next tee. You got to walk around. That's a lot of golfers have problems just because of that. They take these shortcuts and it's just tough on the Achilles tendon going up a short distance that's very steep. The most difficult shoes to deal with are the sport of soccer. And this is another area where we're going to use my flat heel cup shell. Okay. The soccer field will tell you what type of spikes. Grass, the fewer spikes. Artificial turf, shoes with loads of spikes, which are really better and easier to use with orthotics to correct gait. Okay. Two soccer shoes, a difference, but significant. Not great, but significant. Okay. These spikes severely narrow the contact of the heel to the ground. There's way more pronation, way more rocking with this narrow support under the heel. Soccer shoes in general are narrower than running shoes. So this is probably half the distance of the same size of a running shoe when you're walking. Okay. A better shoe a little bit further apart, not great, but at least better. Very important to look at the bottom of soccer shoes that guys are wearing on grass. It's very important. Okay, doesn't look like a lot of a difference, but this is way more support eventually than this width. Okay, you're going to just pronate right through this. This soccer player is looking for trouble. Much better. The width of the spikes. Artificial turf is great because there's a ton of spikes on here, and this shoe is much better support. When you're wearing an orthotic in this type of a shoe with multiple spikes for artificial turf, you're going to get way better control for pronation and supination. Okay, this is way better than the soccer shoes with the very long spikes. Unfortunately, most soccer fields are grass, so this is what you're going to see. It's just that's sort of the way it is. Soccer shoes are way narrower all around than a running shoe. If I have a runner who's got great sport running orthotics, sport flex orthotics, heel cupped with rear foot posts, the same patient's soccer shoe is going to be 3/4 or a half as wide under the heel. So they need a very thin, very narrow orthotic. They're almost getting a lady's dress orthotic for a soccer shoe. And once again, my flat heel cup shell comes into play. For soccer shoes, I always order Dr. Al's flat heel cup orthotic shell with a vinyl full-length top cover, or maybe a 3mm Lunasoft full-length top cover, depending on how tight the shoes are or how minimal the shoes are. You want to definitely take a Xerox copy of the insole of the shoe, so the laboratory can see exactly the size that the full-length orthotic has to be made. Okay? Whenever you're dealing with any kind of athletic shoe that seems to be a strange shape or a strange size to you, it's time to make a copy. Just zip over to your Xerox machine, adjust the setting to photo, and take a Xerox copy. Check that the picture is 1:1, as clearly hasn't been enlarged or reduced, and send that along with your molds to the lab. Or if you're sending in gait scan results, you can send them separately. But mark the patient's name and just show how much heel width and forefoot width the laboratory has to work on that orthotic. Tennis, squash, racquetball, all lateral sports. Different than running. Different shoe. Much lower heeled shoe. Just a different sport. And you want to be careful with not tilting the heel. I go for a 0-degree rear foot post for any kind of tennis, squash, or racquetball player. I want to make sure that there is a forefoot, a vinyl sandwich under the forefoot, so that the lateral sports movement, I'm not going to tear the extension away from the full-length orthotic. Zero-degree heel post. Okay, for squash and racquetball, that tend to have very low heel counters. GPS I asked for, so it keeps the orthotic thin under the center of the heel, always full length. A vinyl sandwich on the bottom. Always want to check for equinus. Tennis players, especially really good high school or university or professional tennis players, are on the ball of their feet always, and sometimes they're kind of tight in the Achilles tendon, and some of them may need some heel lifts. You always want to check. You always want to check for equinus on tennis players. They're on the ball of their feet constantly. Very common. I've seen many professional tennis players over the years, and it's amazing. Almost every single one of them can't get a 10-degree angle at their ankle. Okay, they're just always on their toes, and they just tend to have tight Achilles tendons. Luckily, tennis shoes have lots of room usually, so they're easy to fit a proper sports orthotic. They don't need it to be any narrower than a running shoe type of an orthotic. There's plenty of room It's easy to wear that type of device. Obviously, because of constant side-to-side motion, you don't want inversion sprains. When somebody's got a tight Achilles tendon, you never want to give them more than a 1/8 inch or 3 or 4 millimeter heel lift. You got to be careful. Okay? Too much of a heel lift, and you're going to run into eversion sprains. Got to be real careful. And for most of my elite tennis players, a Sportflex, a Lunasoft top that's full, a 3 millimeter pour-on mid-lay to give them cushioning, a 2 millimeter shell to give them some shock absorption, and a 0-degree rear foot post, and probably GPIS. That's my pretty typical prescription for elite tennis players. If I see 10 athletes that need orthotics, probably 6 or 7 of them are runners. Just everyday runners that are running outside on the roads or cross country. They are running either 10K races. Some are running as far as marathons. The most common sport that I treat with orthotics is runners. This is when I started out, 76, 77. This is one of the shoes that I have saved up, took some pictures. It's a classic. It's the Nike Waffle Trainer. Way back at that time, Bill Bowerman used, I think, his home waffle maker to figure out how to make an interesting bottom to a running shoe. But these shoes had almost no heel lift, and they had almost no support. They covered the foot, and that's about it. They were nice and flexible. There was no really anti-pronation factor at all to these shoes. Many of these runners needed extra support, either for custom orthotics or for prefab orthotics. If you treat runners, this is my recommended running shoe list that you can get from the laboratory. Every month I produce a new list, and I've circled area number 1, which is where 99% of my patients are instructed to buy their shoes. These are all excellent neutral stability shoes. They last the longest. They retain their support the longest. They fit orthotics the best. There are probably 30 or 40 shoes here to choose from. I do a new list every month. This is from back in September 2017, but there's a list for December 2019. It's available from the lab every month, and I tell patients, you're getting orthotics, you can't put them in soft, mushy shoes. You need stability, you need support, and the shoes on top that I've circled are going to last you the longest. The lower shoes on the bottom are softer, they're the same price, they're not going to retain their stability. Stick to the shoes up in level 1. My single most popular shoe, I love the Brooks Adrenaline. After it's in its 19th year now, and it very rarely changes. It's very, very consistent. I've had phenomenal results over the years, and these are all good shoes listed. But I love the Brooks Adrenaline for men and women as the best shoe. If I've got a runner that's running even up to marathon distances for training, you can't beat the Brooks Adrenaline. Very, very good shoe. As the years change, they go from the 2000, the Adrenaline 20 or the 19 to the 18. The shoe is very similar. If you've liked the year before, you're going to like the next year. I have so many patients who change shoes. They get the same brand, but the number on the shoe changes. It's not the same. Once you've got a running shoe that you enjoy using, you want to continue to use that shoe. You want to stick to it. Once you've got runners, you've got to look at their shoes. This is quite amazing to me. On the left and the right, these shoes are ridiculous. You can't walk and run in these. They have round heels. Okay? They're purposely unstable. They're made to exercise in, not to wear too often. They're supposed to build up muscles and tendons that you'd never used. If you try to walk in these shoes and you've never had a problem, you're going to have ankle and knee problems, no doubt about it. I have so many patients come in, show me these shoes. Never had a problem, Dr. Lustig. I've had these for a month. My feet are killing me, or my knees are killing me. Always check a patient's shoes, always. You can see how rounded, how they thought of making these shoes and selling them. I have no idea. This is something that I would recommend. An injury, they'd be sued on. It's just ridiculous, but you see this all the time. Barefoot running shoes 2 or 3 years ago was gigantic. It's sort of disappearing a little bit. And what a barefoot running shoe is minimal support, no heel lift. I recommend patients, you want to try these, put 2 pair of socks on, go out and run in the street and see how you feel. When you're running with a barefoot running shoe, a minimal running shoe, you've got to change your running style. You can't heel strike. You have to forefoot strike. It's a whole new deal. Minimal heel lift. All running shoes have a little bit of a heel lift. All running shoes increase the support in your feet, increase supination in the foot because of the heel. People should not be running in flat shoes. They should not be running in cross trainers. Cross trainers are fine for working out in, but not to run in. A little more complicated stuff, but if you're treating sprinters never hit the ground with their heel. They're on the ball of their foot. This is my sprinter orthotic. It's really a flat heel cup shell with a 4-foot post. Okay, a 4-degree 4-foot post. Okay, this runner is never hitting their heel on the ground as they sprint. Okay, it's low profile, fits in very light, fits in running shoes great. This is not for a marathoner. This is for sprinters. The 4-foot has a 4-foot varus post under the ball of the foot, thicker medially than laterally, and they're getting their little bit of supination help and a little bit of support as they're on the ball of their foot. Most of the orthotics I make are for runners who run long distances. Okay, I'm not a big fan of Tog's Run Flex orthotic. I think the heel cushioning is too cushioned and wears out too fast. So I like the Tog Sport Flex for all of my runners. Okay, 0-degree post if needed. If they have a 4-foot varus or 4-foot post, okay. I want to keep them as thin and minimal as possible. I don't want to fill up shoes and make them heavy. Okay, runners just don't want any more heaviness in their shoes than they have to have. Many different types of designs for different sports, and I've added on for you my 7 basic different types of sports orthotics, and broken down on the next slide exactly how each one is put together. And so if you want to order a soccer, hockey, or skiing orthotic, okay, you go across, and it's a 2mm flat heel cup, a 2mm Lunasoft full-length top cover, plus a vinyl sandwich for men and women. Okay, 2mm for men and women. I try always when I'm using my flat heel cup to keep it at 2mm because it's lightweight, it's flexible. You can go down the entire list, and this entire presentation is available. Tina will get it to you if you need it. It's been a pleasure speaking to you. I think I've gone over a couple of minutes too much. Just the last thing I stuck in there just to remind you, if you're doing golf orthotics, don't remember that reverse Morton's extension under the forefoot of the forward foot. The right foot for righties and the left foot for lefties. You can say there's a lot of stuff here. Okay.
Thank you, Dr. Lustig.
We're happy to.
Fantastic. Thank you so much for the presentation. I'm going to open the, we do have some time actually. We're on a good schedule here. So I'm going to take a look to see if any questions have come through. If something comes to mind, feel free to type in your question in the chat box or the question box. I'll just take a quick look. And not sure if Dr. Lustig mentioned, but if you have any questions, for Dr. Lustig.
Dr. Lustig at villagehealth.com.
Yep, Dr. Lustig at villagehealth.com or .ca. .ca. I'll be emailing all the attendees with his direct email address and his cell phone number. I mentioned this before in other webinars. I just want to mention again for our new attendees. That's his personal cell, his personal email. He is happy to speak to anyone if you need advice, suggestions. You want to send in an attachment of your scan, of your patient's scan. He'll review it. And he'll give you his suggestion. So please feel free. We're a large company, large corporation, and when you have the luxury of speaking with our podiatrist on staff, which is very rare with large companies. So if you feel like emailing, there's an email. If you feel like talking to him, there's a phone number. So we encourage that. And I see a question here, Dr. Lustig. Yes, sorry. The first question, yes, slides will be available. I'm actually going to, for your convenience, I'm going to send you a copy of the presentation as well as the webinar recording for you to listen to afterwards, share with your colleagues. We do have all of our webinars. There's 50 plus webinars online. They have access to, plus the presentations to go along with it. Dr. Lustig, we have a practitioner who's asking, can you explain again the importance of a GPIS?
Yeah, you want me to speak?
Mm-hmm. Yes.
GPIS, grind post into sulcus. Some people have a problem with orthotics. They say they're slipping out of the shoe, they're coming out of the shoe if the heel counter isn't deep enough. To make any orthotic as thin as possible under the center of the heel, you add onto your instructions on how to make the orthotic. Please do a GPIS. That just makes sure that, especially with ladies with narrow heels, they're as deep in the sports shoe as possible. It's a very valuable thing when anybody says, my orthotics are fine, but I'm slipping out of the heel. They need a GPIS.
Great question. Okay, let's see if anything else has come through. A couple more minutes. Well, if you think of any questions after the webinar, feel free to email me. Tomorrow I'll send his contact information and I will attach his recommended, Dr. Lustig's recommended orthotic list, as well as his footwear list that he mentioned in the webinar, and any other documents that we feel are important for you to have reference to in your clinic. I will be attaching those documents for you. And I want to say thank you very much again for joining us and spending 1 hour with us. Just wanted to mention 2020 education program live seminars and webinars. A schedule will be posted hopefully by February, beginning of March. So look out for that. You'll get email blasts, but you can visit tog.com and you'll find all the information under the education page. Thank you very much and have a wonderful day or a wonderful evening. Bye.